following a review of the prevailing situation in the country and consultations with our epidemiologists, the National Emergency Response Committee, as well as Ministry of Health technical advisors, and as pronounced by His Excellency the President in his Mashujaa Day address to the country, and taking into account the very critical need of ensuring the country remains on track in the containment of the disease, the following strategies are proposed for implementation. Number one, everybody seeking in-person government services should be fully vaccinated and proof of vaccination availed by December 21st, 2021. Such service will include but not limited to KRA services, education, immigration services, hospital and prison visitation, NTSA, and port services, among others. In order to accelerate the vaccination, the ministry, in collaboration with county governments and other stakeholders, will be undertaking a 10-day mass vaccination exercise from November 26th with the aim of administering adequate vaccines as well as to as many people as possible. Number two, counties should A, take up testing at facilities by increasing the capacity of clinicians to detect and test those at present with any symptoms. Number B, ramp up vaccination by integrating COVID-19 vaccination activities into routine clinical services and public health services, such as during ward rounds, routine and special clinics. C, continue providing water and soap for use at public places for hand washing and sanitization. And D, provide vaccination services through outreach during market days, days of worship, and other approved occasions and events. Number three, when seeking transport services, clients should A, show proof of vaccination when using domestic flights. B, show proof of vaccination before use of train services, that is SGR. C, show proof of vaccination before boarding buses, matatus, and or regional travelers. D, all motorable operators, that is drivers, conductors, border riders, pilots, air hostesses, and all other working in the sector should be fully vaccinated and carry proof of vaccination at all times. All these measures in the sector are to be coordinated by the ministries concerned, and we are in consultation with each ministry concerned. As you can see, CS Balala is here today for the area of tourism. I'm in contact with the CS for transport, CS Macharia, as well as the other people who are involved in the transport sector. The Matatu Owners Association, the Border Association, as you're aware, we have been carrying out programs for vaccination in all those areas. And therefore, we are involving all stakeholders in this exercise. It is not a standalone institutions. We are also appealing to the Interfaith Council to meet and address this matter in their own way, in a manner that we have asked them to coordinate so that they can also form an integral part in this exercise. In public spaces, for example, A, you must show proof of vaccination for admission into national parks and game reserves, hotels, bars, and restaurants. All businesses, including small and medium enterprises, serving 50 or more people a day, to put up signage requiring proof of vaccination before entry into their premises, and their patrons to be fully vaccinated.